My name's Claire Paling and I'm going to present an overview of this paper, including the findings and the implications for practice. The aim of the paper was to explore physiotherapists' experiences of managing persons with suspected cauda equina syndrome, and I carried out interviews with 8 musculoskeletal physiotherapists using open questions to find out about their experiences. We used thematic analysis with peer review and found 5 themes which ran throughout all of the transcripts. 2 of the themes seemed to relate to factors which caused panic, anxiety, and worry to physiotherapists and might represent challenges. The other 3 themes seemed to represent antidotes to these challenges. The first theme was worry in relation to risk management, which was partly due to fear of missing anything, and there were accounts of participants ruminating over scenarios and having sleepless nights because of concern for the patient and concern about avoiding litigation themselves. They also expressed concern regarding resource management, particularly in the context of the fact that they were expecting cauda equina syndrome to be excluded in most of the patients they were sending to the emergency department. The second theme was communication difficulties, and they expressed a struggle to reach a mutual understanding with persons with suspected cauda equina syndrome, which interestingly is reflected in some of the literature looking at patients' experiences of going through the same consultations. They also talked about conflict in communication with other healthcare professionals, including orthopaedic registrars, and struggles with handovers. The third theme related to teamwork and shared responsibility and how shared decision-making helped to share the burden with their colleagues and alleviate panic, anxiety, and worry. The participants also talked about the usefulness of having a written, step-by-step, clear pathway, and the pathway in this trust included the CES toolkit, which was developed by Green, Hallett et al., published in 2016, and includes a questioning cue card for clinicians and a cauda equina syndrome credit card for patients. The fifth and final theme was about perceptions of improved confidence and competence over time with experience and also with training on cauda equina syndrome. The paper then goes on to discuss these themes in the context of previous literature and to present some implications for practice. So first of all, it's suggested that a cauda equina syndrome pathway would be recommended as per previous literature, which has recommended a robust multidisciplinary pathway. It also might be helpful to foster a team working culture to help share the burden of any concerns surrounding the management of this group of patients. Use of communication aids may also be helpful, and that could include the cue card for clinicians and the cauda equina syndrome credit card by Green, Hallett et al. Also, handover tools like SBAR might be helpful to aid interprofessional communication. Training on cauda equina syndrome seems to be important as well, and could include training on the condition itself as well as communication techniques relating to the management of patients suspected of having it. And finally, consideration for staff well-being also seems to be important in relation to the management of this group of patients. So in conclusion, there do seem to be a number of challenges that physiotherapists are faced with in the management of suspected cauda equina syndrome, and it may not be possible to absolutely eliminate these, but it is important that we are aware of them and that we strive to minimise the risk to our patients as well as looking after our organisations and our staff. There's lots more detail within the paper itself in the discussion and some practical implications for practice, so do have a read through. And I'm really interested to receive feedback from people, and particularly interested to know if this resonates with your own experiences of managing patients with suspected cauda equina syndrome.